Thank you very much. And great to have heard that example of how things should have been done. And we have had an implicit default contain, suppress strategy. But since we've never had an explicit strategy, we've never been able to debate it. And what we've had, as we all know, is chopping and changing between different approaches. And we should never have been in the situation we're in now with the present lockdown. Had we used the summer to drive transmission down and develop a functioning test, trace and isolate system, we could have been in a situation where much more was open. However, we are where we are. In March, compared to now, things were actually not so bad, because now we have much higher community transmission. We have the cold weather, and the virus lives for longer in the colder weather, plus we spend more time indoors, which makes us at much more risk of aerosol transmission. Plus we have a new variant that's at least 50% more infectious. Plus we have the NHS that is being overwhelmed, is not just in danger of, it is being overwhelmed. So for all these reasons, the logic would say we should have a tighter lockdown than we had in March. We need to do more to keep people away from each other, but we have a laxer lockdown in England. Well done, Scotland, for having recognised the problem and increased the restrictions. And I know Wales is taking similar measures. But the bottom line is that we need to separate people who are infected or could be infected from those who are not. Currently, what do we have? We have all sorts of unnecessary businesses, shops, services, other sites open. And that means that people are traveling. We have the possibility of people going in and out of each other's homes if you pay them to clean, to look after your children, to come and paint and decorate. All of this is non-essential. All of it is carrying the virus around our community needlessly. And all of it means more people traveling, which, if anybody's seen the pictures of overcrowded tubes, same on buses, it only takes one infected person on a construction site, in an office, on a bus, for that to be a super spreading event, because it isn't just the aerosols, but it's also touching the same surfaces. So that's an obvious thing that we need to do right now. And what we also need to do is to ensure that everybody is supported. It's not enough just to shut all these things down, to tell people they can't work. They must be supported financially, practically, socially, and psychologically. And we heard from Michael about other countries. Those countries that have invested in the short term to suppress the pandemic using everything that they can have been the ones who've been least hurt economically. So the health versus wealth argument is obviously completely spurious. Michael went through the things that we need in terms of a strategy right now. Thank goodness, at last, we have border controls. But a huge, big weakness now, apart from having all these places open that shouldn't be open, is the lack of the test, trace and isolation system. We all know that's been put into contracts with big commercial companies who don't have the experience and the expertise. Local public health infrastructure, based in local authorities, working with primary care, coordinated by the NHS, has been shown to be really effective where they've been allowed and given the resources to do it. So that's what we want. But for people to isolate, they need to be supported. Other countries, you have people visiting every day to offer practical support, like, do you want help with taking your rubbish out, or do you want help getting provisions? Do you need any social or psychological support? They also get offered free alternative accommodation. Most people can't isolate in their own houses. I mean, who lives in a big enough house that you have your own kitchen and your own bathroom? So we need to learn from other countries in doing this. I mean, even New York City offers free local hotel accommodation, free meals, free Wi-Fi. You can take your children if you need to. even pet care is offered. This is what's needed if you're serious about removing those people who are infected or who might be infected from everybody else. And unfortunately, rather than a sort of strategy of engaging, partnering with communities to learn what the problems are in terms of adhering to the different kinds of restrictions and guidance, i.e. an engage and support approach, our government has consistently taken a blame and punish approach. And interestingly, I don't know who saw Boris Johnson yesterday, randomly beginning to talk about hand hygiene and keeping your hands clean and how important that was. All seemed quite puzzling. I didn't know where it came from. And then I thought, well, probably this is because this can be an individual responsibility. We can all take responsibility for keeping our own hands disinfected. But who needs to take responsibility for ensuring that there's investment in workplaces to keep them ventilated so we wouldn't get infected through aerosol transmission, or at least reduce the risk of, to ensure that there's enough spacing and screening, to ensure that there's enough inspection, to ensure that standards are being adhered to. Whose responsibility is that? That's the government's responsibility. At the moment, what do? They don't take responsibility for any of it. There's not been the investment at a government level. And then
Susan, can I just point out you have 2 minutes to go? Sorry about that.
No problem. That they're leaving it up to employers to decide. They're leaving employers to decide who's an essential worker. That's another difference between France. So many people are essential workers. Lecturers with big teaching loads, they're essential workers. It's absolutely enormous. And so employers are deciding that. And every week I get so many emails of people who are absolutely distraught, working in manufacturing industry, construction industry, working in early years settings, working in the public sector, working in finance, who the employers are saying you have to come in and it's not safe. So this is a classic, shifting the responsibility, distracting from where the real issues are. And I'll just finish with a problem about this punishing. £10,000 fine if you don't isolate at home, when so many people can't afford to do that. So what happens? People aren't getting tested. The Liverpool mass testing evaluation showed that in the most deprived community, 4%, only 4% of people were coming forward for testing. Overall, the most deprived communities were 20 times less likely to get tested, but 20 times more likely to be infected. And this is the direct result of government policy. So I'll just really end on the fact that time and time again, this pandemic has shown that the people have been really responsible. People have wanted lockdowns earlier than they've come. When we have polls, people want tighter lockdowns. And I think that's a salutary lesson, that people are sensible. They do know when they see a really big threat what needs to be done. And it's brilliant to see organizations such as this getting together people to share their expertise, their perspectives, and to find ways of collectively trying to force this government to come up with a coherent and effective strategy. All the best. Thank you very much.